When I talk about cancer in the office, I enjoy talking to my patients about being aware of what cancer prevention is important for them. I think it's very important for each individual patient to understand with their family history and their medical conditions, their medications that they're on, what does apply as far as cancer prevention screening. The different types of cancer prevention screening, whether it be colon cancer prevention screening, CT lung cancer prevention screening for current and past smokers, or whether it be pelvic cancer screening. I also talk to patients a lot about skin cancer awareness and cancer prevention for skin cancer. And so being aware of sun exposure, making sure we're preventing the excessive sun exposure by wearing hats and wearing our sunscreens, making sure that we're aware of our skin and any changes that we notice, such as moles. And so they talk about teaching the ABCDEs, and so asymmetry and border and diameter and things like that for skin cancer awareness for patients. I also like to talk to patients about what they can do to help with their cancer prevention. And so just a healthy lifestyle. And so healthy nutrition, including fruits and vegetables, has been shown to help reduce the risk of developing cancer in our lifetime. So for example, high fiber diets or appropriate fiber diets help to reduce the risk of colon cancer. And so we talked about previously the risk reduction with sun exposure can help reduce the risk of malignant melanoma. And so talking about healthy lifestyles, including nutrition and hydration, including at least 150 minutes of cardiovascular exercise weekly. And now we have vaccines which can actually help with some cancers. And so the HPV vaccine directly helps reduce the risk of cervical cancer and helps reduce the risk of other type of cancers from HPV virus. I find cancer prevention screening can be done at really any office visit. And so even for an acute visit, you can talk to somebody, or you can always ask if they have any skin changes, which helps to bring in the discussion. It's a really good opportunity at your annual physical to talk to your doctor about your cancer prevention. And so we oftentimes look at patients based on their age and their family history to help stratify their cancer screening. So oftentimes, for example, prostate marker screening is recommended at age 45, mammogram is recommended at age 40, colonoscopy for most patients is recommended now at age 45. And if there is a family history and a first degree relative, like a mom, dad, brother, or sister, then we would look at the age of onset of that cancer and then actually get the cancer screening even earlier than the recommended baseline screening. So for example, if a parent had colon cancer at 45, a patient could actually be starting their colon cancer screening at age 35. I also like to talk to patients about being aware of their body and specific changes that go on in their body. So things as sudden weight loss, and so over 10 or 15 pounds of weight loss for unexplained reasons, night sweats, weakness, fatigue, swelling of glands and areas, and things like that can be very helpful when we look at it to talk to your doctor about.